Hello, everybody. I'm Dr. Shawn Griffin. I'm the president and CEO at URAC, the accreditation organization based here in Washington, D.C. One of the things that we get asked about is what do we see coming in 2024? And we follow a lot of the publications that are out there. We follow Modern Healthcare, we follow Becker's. I happen to be a big fan of Becker's. Almost every day, I will take a look at Becker's newsletter, their hospital, overview, those sort of things. But they had an article at the beginning of at the end of 2023 talking about 2024. And they talked about 12 trends and issues that they're following for 2024. And I wanted to share sort of our take on it, where we sit within healthcare with accreditation, with raising quality, also being in DC and being very involved with the regulators and the legislators. There's a few of those topics that I want to talk about and share with you. So one of the topics that they talked about was behavioral health and mental health. And that is a very strong emphasis here in Washington, D.C. There were some rules at the end of last year talking about mental health access and mental health parity. There are committee hearings and those sort of things. Now, we have a special view there because we are the only mental health parity accreditor. And we're hearing the stress from the payers about, what are the liabilities, what are the risks? Employers are saying the same things. But we also have this workforce shortage. We have parts of the country that have no providers. And we've seen how telehealth and telebehavioral health have helped to fill in those gaps during the year. Well, these issues around mental health are not just limited to healthcare. We're also hearing about very stressed workplaces. And the pandemic raised everybody's stress level, and there was isolation and magnification of pre-existing conditions and those sort of things. And so that's one of the reasons why at the end of last year, we launched our mental health at work accreditation. That's a specific program that's focused on assessing and improving the mental health space for the work that goes on in all different types of organizations, everything from healthcare to law enforcement to associations. We've even talked to some organizations like state departments of health want to know more about these programs. We think that's going to continue to be an emphasis this year. There may be some legislation that comes out, there may be some rules that come out, but it's going to continue to be a stressful place. If you want to find out about any of our programs that I mentioned here, just go to our website, look at our standards at a glance. Those are free for everybody. Thing that we talk about is how do we deal with just the day in, day out aspects of life when it comes to access. I trained in rural family medicine. I'm from a part of the country where you don't have many providers at all in any discipline. And so what we're seeing is we're really seeing organizations lean into remote patient monitoring, lean into telehealth. And we think that that's because they just can't be everywhere at the same time. There's a need for broadband in rural communities so that they can have at least some access. But there's going to have to be some legislation to support that. In 2023, there was some legislation that was passed that allowed for the telehealth flexibility that came out of the pandemic to continue through 2024, but most of it ends at the end of 2024. So look for some activity in that space. If you are involved in telehealth, if you're a hospital system that's doing it or a clinic or a private firm that's offering telemedicine, you need to be talking to your legislators. You really need to be speaking with them about the good examples of telehealth, because every time some bad example comes up in telehealth, which I call telefraud, that always gets splashed across the headlines because people love to highlight the negative stories. But there's a lot of good behavioral health telemedicine, children's health telemedicine, chronic care, cancer care, telehealth, that we think those stories need to be told. So be sure to talk to your legislators, both in the state and federally, so that your story can get out there also. Next topic is technology and artificial intelligence. Artificial intelligence is going to be splashed into every technology this year. I swear that I was watching the evening news at the end of last year, and AI was a story for like 10 days in a row on the evening news, the national evening news. The biggest problem with AI is that it's a tool looking for things to work on. Now, I spoke on AI about 7 years ago to a bunch of CMIOs, Chief Medical Information Officers. And at the time, I said it was all hype, very little meat to it. The good news is there's some meat to it now. It tends to be in very data-intense areas, but there's still a lot of hype. There are technology organizations who will say AI in their pitch, even if there's not much there. So you have to be suspicious of when people talk about AI, what are they talking about? And any company that wants to promote artificial intelligence needs to have real intelligence underneath it, or the AI is just all smoke and mirrors. The last thing that I want to talk about is that we have an election coming up this year. You may have seen it in the news, but it is going to throw off everything. there's going to be a couple times this year where all of Washington, D.C. gets focused on something related to the election. Maybe it's a fight, maybe it's a budget showdown, maybe it's a government shutdown. But we really need to make sure that we are involved not just in the national elections, but in state elections where they're happening. We want to make sure that we're talking to the regulators. We go over on the Hill periodically because they want to know what we think about things like telemedicine and mental health parity. And so as we talk with them about that, they say, well, what are we hearing from our constituents? So the more that you share with us your positive stories, the more we can share it with them. But I would also again say, we want to encourage you to share your stories, your challenges with your representatives, whether it be your state legislator or your congressperson or your senator or regulators. But it's really sort of one of the things that healthcare always needs to be doing is to tell our story and our patient stories so that they can be appreciated, the differences that we make in our communities. Every day here at URAC, we're thankful to work with organizations across the country and across the world on raising quality in healthcare. And we just say, tell your story also. Help us to tell your story, because it's really about taking care of our communities. And we hope that you have a wonderful and prosperous 2024 and keep up on the news and stay involved. Thank you.